The challenge that we face in healthcare, that is, we wish it were more affordable and accessible and higher in quality and effectiveness, isn't a problem that's unique with healthcare. Literally every industry in the world has run into these problems at some point in the past. And there is a pattern that is just pervasive in how these problems have been overcome in other industries. We saw the pattern beginning in healthcare as well. And so I'd like to describe what we have seen there. So what I'd like to describe here is a model for how this happens. And I want you to focus first on these circles. And what they represent is, in the middle, these are customers, or in healthcare, patients, who have the most money and the most skill. And then the larger circles represent larger populations of people who have less money and less skill, until you come to the periphery, where you don't have much of either, and where I have lived most of my life. And the challenge is, how do we get things from here to here? I'll put on the vertical axis the performance of a product or service over time. There are two elements of this model. The first is, in every market, there's a trajectory of improvement that innovating companies provide. Now, some of these innovations that make good products better are incremental, others are dramatic breakthrough investments. What we find is that the companies that are the leaders of the industry on the left side, after all of these improvements are done, find themselves still the leaders on the right side. In other words, the existing providers see it coming and are on top of the challenge. Then there's a second trajectory, which is the ability of customers to use technology. And always, the trajectory to provide technology overshoots the ability to use it, which then it creates interesting problems. But what it means is that a company whose products are not good enough for what customers in the mainstream market might need at one point in time find themselves overshooting what they can use at a later point in time. What we find is that these kinds of innovations that we call sustaining innovations are pervasive. And almost always, as I mentioned, the incumbents dominate the battles of making good products better. But there's another type of technology that we call disruptive technology. And we use the word disruptive not because it's a breakthrough improvement, but rather it changes a product that is complicated and expensive into something that is affordable and simple. And what we found is that on this dimension of innovation, almost always, the leaders here miss this, and it's entrants that come in to make things affordable and accessible. And the reason why that's important is that when we want to make healthcare affordable and accessible, what it says is, on average, we ought to plan on these people doing it, not those. So, how would you get healthcare affordable and accessible? Well, here I was, living my life in the periphery, and our doctor made house calls through the 1950s. But then the advent of sophisticated technology drove a centralization of the healthcare industry. This is driven by the sophistication and the costliness of advanced technology. So the question is this: I wonder if healthcare will become affordable and accessible by hoping that the hospitals will become cheap. Or will it become affordable and accessible by having the specialists who work there to step forward and unilaterally agree to take pay cuts? I'm not sure that's going to work. But rather what we have to do is disrupt them by making things affordable and accessible so that larger populations can have access to better care, not worse care. And so we need to bring technology to the clinics so that they can start to do there the simplest of the things that today have to be addressed in a hospital. Then we need to bring technology to the doctor's offices and then retail clinics so that people can do there the simplest of the things that had to be done in a clinic. And then ultimately we need to bring technology to the patient's homes. And in a similar way, rather than expecting the doctors, the specialists to become cheap, we need to drive technology into the practice of personal care doctors. And then bring technology to nurse practitioners and the pharmacists so that they can start to do more and more of the things that previously had to be addressed by a personal physician. And then we need to bring technology to the primary providers. And so if there's just one thing that I hope that you remember, it is this, that rather than expecting healthcare to become affordable by expecting the existing providers to become cheap, we need to bring technology so that lower cost venues of care and lower cost caregivers can do more sophisticated things. That's the way to do it. Hospitals aren't possible. And the reason is that in every hospital, the value proposition that hospitals make to mankind is, I actually don't care what's wrong with you. We will actually do anything for anybody. And that is a very complicated value proposition, that there are actually no other institutions in the world that claim that they could solve every problem for everybody. And in fact, in order to try to do this, there are within a typical hospital 3 types of businesses. And there are actually only 3 types of business models in the world. They are all incompatible with each other, but they exist in a hospital. So the first type of business model we call a solution shop. And a solution shop business is in the business of telling you what's wrong and giving you recommendations. The activities in a hospital that entail diagnosing the problem and then recommending a solution are solution shop businesses. And these kinds of businesses make money on a fee-for-service basis. The second type is a process business, where you bring stuff in, you do stuff to it, and then you ship it out. A medical procedure is a process business. These guys make money on a fee-for-service, they make money on a fee-for-outcome. And if you do it this way, instead of messing up the process with all of the stuff that goes on in a solution shop, boy, you can do it cheaper. And so the Shouldes Hospital north of Toronto, all they do is make hernia repair. And they can do a quality outcome that is 12x better than the typical hospital in Boston at 35% of the cost. Because in a hospital, because of the complexity, 85% of the cost is overhead cost, because they're trying to do everything to everybody. And then the last type of business we call a facilitated network, where essentially the patients help each other. And a lot of diseases that are chronic in character, the patients can actually give better guidance to fellow patients. They make money on a fee-for-service basis.